All of us are going to age, and when all of us age,
Could you please explain to our viewers in simple terms what palliative care is all about?
the amount of symptom which a patient has to suffer and treatment induced side effects which the patients have to suffer and their families who are taking care of them also have to suffer, palliative care is an answer.
Sir, a lot of illnesses not just affect the patients physically, they also affect them emotionally, spiritually, they affect their relationships. So, how do you think palliative care addresses these concerns in patients?
This is all coming from the hope.
A lot of the times, patients feel that starting palliative care means giving up on treatment. So, how would you like to address that?
Having worked in this field for 15 years, even today I find communicating with them challenging.
There are times when many families are not very sure of palliative care. What would be your one piece of advice that you would like to give to our viewers for such families?
So, answering your question, one piece of advice.
Hello, viewers. Once again, we welcome you to the Health and Happiness podcast presented by SastaSundar. Up until now, we have discussed many health conditions, but today we will not talk about any specific medical condition. Instead, we will talk about the approach to managing it. We will discuss palliative care with a very renowned clinical psychologist and volunteer of the Department of Palliative Medicine at Tata Memorial Hospital, Mumbai, Dr. K.V. Ganpathy. Welcome to our podcast, sir. We are
Thank you.
honored to have you here
Thank you so
today.
much.
Sir, a lot of people are not very familiar with the word palliative care. Could you please explain to our viewers in simple terms what palliative care is all about?
Sure. All of us are going to age. And when all of us age, what happens? Your vision comes down, your auditory senses come down, that is, you can't hear completely, your knee starts paining, right? So, a simple aging process can bring in a lot of discomforts. Now, normally a family would want to run from one doctor to the another doctor, thinking that it's a disease. It's not. It's age related condition. Okay. Now, when we uh, talk of palliative care, we are talking about what happens to a patient or a person who has been diagnosed with some chronic condition. What is a chronic condition? Condition that persists for a long time, where you can manage it with drugs. For example, I'm diabetic, so I'm palliative. I have to alter my lifestyle, I have to work on my diet, right? That'll help me to lead my productive life long time. So there are different chronic conditions. But today we are here specially to talk about palliative care in the oncology setting. Okay. Now, cancer is one disease where the treatment is even more severe than the disease itself. The amount of symptom which a patient has to suffer and treatment induced side effects which the patients have to suffer and their families who are taking care of them also have to suffer, palliative care is an answer. Now the next thing is, when we talk about palliative care, we have medical aspects, the physical discomforts, the physical symptoms which is caused by the disease and by the treatment, they are handled by the palliative care physician. Now, you have a disease, you have a cancer in a particular place, and thankfully the doctor has treated it. What happens? You think the journey has ended there? No, right? You might sometime experience, is this disease going to come back? You have one little fever and you're scared. Oh my God, am I going back the same road? Then your lifestyle is so much altered, okay, depending on the disease. For example, if your disease somewhere in the oral mouth area where you can't speak, you can't chew, you can't bite, and you're absolutely foodie, what happens to you? And because of the radiation, one of the treatments, your face is absolutely disfigured, and you're a very popular person with all your friends, what happens to you? You don't want to go meet them again, because for you, your body image is very, very important. So isolating yourself from that crowd causes a lot of social pain. Okay, how many times my family said, don't do this, eat good food, whatever it is, right? I used to be a chain smoker. uh, they said, don't smoke, don't have habits, but I could not. I got into habits so much that I could not really take care of it. Now I'm feeling guilty, emotional pain. Then I go to God. I said, am I the only person who has done all these things? There are so many people in this world who are smoking and drinking, and they are walking so freely outside on the road. Why me? You're addressing God. Your distress is towards God. I'm such a nice person. Every morning I get up, I do puja of Kalima. Then only I come over here to the hospital, and I've been serving so many patients. Why are you punishing me for that? So that is the spiritual distress, pain from spiritual dimension. And then the most important thing is your existence. I struggled all my life. I sacrificed so much. I focused so much on education, to setting up something, realizing my goals. Finally, after all that, I have to suffer this. Why me? So, as a human being, you suffer. As a patient, your symptoms are taken care of. But lot of other factors which you as a human being you suffer is what we addressed in palliative care. So doctors look at the physical symptoms, and we psychologists look at psy- psycho-socio spiritual dimension. So just to understand, normally the medical aspect, the care has been focusing only on biological model, your body, your organ, your disease, and a cure. They forgot the human part of it. But in palliative care, we are telling you that we perhaps cannot change your destination wherever the disease takes you, but we can definitely impact the journey, how you travel a journey. So, three important things you have to understand in palliative care is excellent symptom control. Secondly, is quality of your life. No matter how long you're going to live, are you able to lead your activities of daily living by yourself as much as possible? And dignity, right? We want to restore the person's personhood, and not remember him or her only as a patient always. This is palliative care.
Yeah.
I hope I'm clear to you.
Yes,
Yeah.
that was a great explanation, sir.
Thank you so much.
Sir, how will be palliative care different from regular hospice care or regular treatment?
Okay, normally when we talk about palliative care, now a chronic condition, before you have to say that this is your diagnosis, you're going to become scared. Oh my God, I've heard cancer means death. There's nothing like that. But not all cancers are that way. Today, science has advanced so much. There are people who are doing exceedingly well in their life post cancer also. But you could have post traumatic stress. Kahin वापस आ गया तो what will happen? So that is one thing. Therefore, especially in a chronic condition like cancer, the emphasis is not just the doctor who's going to give you chemotherapy or radiation therapy or immunotherapy, whatever it is. There is also a psychologist who's part of the team. Because first time you hear the diagnosis of one of your loved ones, your dad, mom, brother, husband, sister, it's going to be terrible for you. Oh my God, cancer. But the doctor is hopeful. He's going to say, okay, don't worry, I'll give you 6 chemotherapy cycles. Maybe after 3 chemos, we will do a PET scan. We will see how the chemotherapy has impacted. It'll go on and on. Now, suddenly, after three, this thing, your symptoms have improved. You know, you had obstruction, you could not pass your motion very comfortably, you were not having appetite, so you know, a lot of problem. Now, from the first chemotherapy, these symptoms are taken care of. You know, and typically in India, we believe absence of symptom is absence of disease. But perhaps the doctor know that maybe your cancer can be a little aggressive. It may not listen to chemotherapy, but he's trying because you're very young, still can try. Yeah. So, to answer your question, how is it regular from hospice care? Hospice comes at the end. So, we have early palliative care. Doctors believe within 8 weeks of diagnosis, the physician who's treating you with medication, along with a psychologist, social worker, volunteer, multidisciplinary team, are looking at other human aspects. Okay, because doctor is very busy in the OPD, a lot of patients, he might not have so much of time, but you're very comfortable talking to me. I'm talking to you as a human being. I'm not talking to you as a CA breast or CA cervix or any other blood cancer or anything, right? So I'm here to address your concerns, and you're going to talk to me how life has taken a different course. What were your dreams? What were your aspirations? What were your goals? So your suffering starts there, right? So we have something called as early palliative care for two reasons: that there is a possibility that your disease could worsen after a period of time. So this early palliative care is a kind of a relationship building exercise, you can say, a therapeutic relationship, right? And also concurrently, along with the doctor who's giving you medicine, I'm also talking to you what's happening. I'm preparing your caregivers. Your husband is taking care of you, your dad, mom, somebody's taking care of you, gently telling them, what they should expect. And today, more and more oncology care, cancer care has become OPD basis. Matlab, you don't have to be getting admitted in the hospital. Doctors explain to you what medicines, how you have medicines, etc., and you have been taken care unless your symptoms are terrible. Okay, so that is the early palliative care. Slowly, your disease worsens, and you doctors realize that now no more anti-cancer treatment. कुछ नहीं होगा. This disease is irreversible. The palliative physicians say that we are now going to take you to the next step, that is best supportive care. What happens there? Any normal, your family physician can be helpful to you. That's one of the things that we always tell the family, that ensure that you have a family physician within 5 minutes of your house, because there are some symptoms that will come only in the night. And tell the doctor very clearly that I know why my patient is undergoing this. Right now, the patient has a severe pain here. Can you just address a pain? So, like, I would get a pain, or you would get a pain, right? For a bad posture, a bad position, or you're a sports person, some way you have what do you call, your ankle is twisted, something. So you go to, before going to an orthopedician, you go to family physician, gives you pain medication, right? So like that, this family doctor can give you pain medication, so that at least your sleep is not disturbed. Remember, we told you comfort, activities of daily life, right? You can walk up to the washroom and manage yourself. You can walk up to the bathroom and take care of your bath, right? When you're not able to do that, that's when this physical symptoms exacerbates and gets into psychological space. I'm so useless. Even for a glass of water, I have to depend. I'm unnecessarily troubling all these people over here. And you start feeling guilty. Then slowly you say, I pray God that you give me some medicine and let me die. I don't want to be like this. I don't want to meet my friends. They have seen me looking so beautiful or so handsome, and I've been calling shots. Now I'm lying down helplessly. I don't want them to see. You know, so that is the second best supportive care. A care whenever you have symptom troubling you. So typically when the cancer advances, we have seen symptoms like extreme fatigue. You would have slept for 8 hours, you'll get up tired only. You'll never feel fresh. Second thing, you'll have severe erratic the thing functioning. You might have either a constipation, or you'll either have a, what do you call, loose motion, or there could be collection of water fluid in your, abdomen or in your lungs, depending on where the cancer is, which can make you breathless. There could be some bleeding. So these are some classic symptoms advanced cancer patients exhibit. Okay, it is not that there is a timetable and everybody will face the same thing. Monday will be X, Tuesday will be, no. Generally, we have seen statistically this is what it is. So there, the doctors can give you medicine and control that symptom. Again, quality of life. You get good sleep. You have some appetite. You are able to do basic walking. You can at least make a cup of chai, right? Right? It could be possible your parents are old, they themselves are needing some medication, some comorbidity they have, and it is, you feel very bad troubling them every time. So at least I'm making you walk. You can do this much more, right? That is the second best supportive care. The third one is end of life. This is, through this podcast, you have to educate a common man that palliative care is not abandoning you. Palliative care is not giving up hope. Palliative care is reinforcing that you're a loved human being, and we want you to live comfortably with very less compromise on your quality of life. That's what we want, right? Then you move to the third one, end of life. Okay, so you have Premashya here, which is like a hospice. Now there are many people, uh, you know, who have a very small house. They might be staying even in a, shanty, and they may not find peace over there. Or like normally people say, oh, home, getting into the home is very important. That's why TMC, Tata Medical Center, also has a home care where they can go to the patient's home and they can you know look at the advanced cancer patient. They are not able to come, either they have no money or whatever it is. They have some arrangement of home care. Like we in Bombay, we have regular home care where every morning they identify 5 patients, and one car goes to south of Bombay, one car goes to north of Bombay, so five patients, a doctor, a nurse, and a social worker, or sometimes a nurse, a volunteer, and a social worker. Right? We want to check whether the patient is complying with the medication, eating the medicine regularly. How is the caregiver doing? Is the caregiver slipping into depression? Then we need to do something, because right. So, but home care is very economical, and it can sometimes be challenging. Especially, I work for a lot of pediatrics children, so I know that when we're trying to send the patient back home, because we didn't want the patient child to be around doctors with aprons and stethoscope, because child is very traumatized seeing all kinds of disfigured patients. So we prefer home. Home is a place that people normally should be there. But if their home is not a home, mother is supporting child alone, father is a drunkard, every night he comes and abuses the thing, the child in that disease also is traumatized. So for such people, we have hospice. Okay, hospice is a once again an assurance to common man that you will be looked after, you will be taken care of, and you will live with dignity. I recently had a case where the girl was 14 years old, and she had a lot of having a lot of menstruation issues. And uh, when I said home care, the mother cried. She said, I live in a makeshift small house where the staircase is, you have to climb kind of a tree and get into the thing. And because of the medication, she feels very hot. There is no ventilation. So pleaded, she said, don't send me home. That home is not a home. So such patients, we take them to hospice. So you have to understand early palliative care at the beginning onset of the symptom. Normally, doctors look at 8 weeks is what they say that early palliative care should come in. Then best supportive care, right? And then end of life. So in cancer as a chronic condition, the trajectory of some cancers are very short, 4 months to 6 months. But for some cancers, I have seen that the patient lives even for 2 years. What is very important? Activities of daily living. The patient feels नहीं, हाँ मैं खुद अपना चाय बना सकती हूँ. I feel good. I'm talking to my father, reminding him, have you taken your medication? I'm telling my mom, you take some rest. Let me do something. At least I'll fold the clothes. इतना तो मैं कर सकता हूँ, right? So when you're talking about palliative care, the way we approach very elderly, we call it geriatric, right? 65, normally 60, 65 is upper. Then young adults, now 19 years to 39, 35 or 36 years. That's the area is very, very important, right? Because they all have working towards their dreams, their goals. They want to buy their own house. They want to have some holiday. They want to do something with the family. There we help. And again, adolescents. So my specialty is adolescents. I work with adolescents, right? And then children. That's how we look at palliative care.
So, sir, like you were already explaining, that patients suffer from depression, anxiety, etc. during cancer. So, we would also like to know if this happens to patients suffering from other terminal diseases as well.
First thing, you should not use terminal diseases
Okay.
because you're already qualifying that person is going to be terminal. So there are a lot of mental health issues. Okay, so the first thing that you have to look at when you're talking about palliative care is any chronic condition where the person's condition is being managed medically and psychosocially. Is it clear? Okay. So there is a person who has got diagnosed by a psychiatrist or a mental health professional that primary anxiety and secondary depression. Okay. We can manage that because that diagnosis of primary anxiety, secondary depression can impact your life very much. How? If I'm a person with anxiety disorder, normal anxiousness is okay. You've written an exam morning, आपका result है 10 बजे, you're getting up with a, oh my God, what my result is going to be. I hope I pass. I hope, because there are a lot of dreams attached to that thing. That is very normal. Once you go to the college, you get your result. Okay, you fell short of 2 marks. Otherwise, you would have been a topper. You can cry for half a day. Okay. Uh, there is a rare possibility that it can lead you further in the road of anxiety and become a disorder. So disorder is you're frozen. You'll never attempt that again. Like we say, once bitten, shy for lifetime. This is once bitten, shy for 7 lives. You're already imagining the consequence of that condition before even attempting. So 5 interviews you have gone, you're not been successful for some reason. You as a human being is going to feel upset and their anxiousness will seep in. But if you say, no, I will never again attempt the interview. मुझे पानी का डर है. Okay, I will never again enter a swimming pool. So what happened? I'm compromising. I was so much wanting to learn swimming, but I can't because fear of what. So coming back to your question, chronic conditions where there is no cure, but medicines are there to care, and concurrently counseling and psychoeducation, psychological interventions will also play a role. There are non-pharmacological way of treating. For example, very simple, a cancer patient is very worried about chemotherapy because he or she has read so much about chemotherapy. Okay, so it can be sleepless. So we use something like cognitive behavioral therapy, where we are non-pharmacological ways. We are trying to look at the negative thought. It is the way you think is influencing your emotions and behavior, etc. So by disputing those thoughts and helping you to restructure the thought that yes, chemotherapy will cure me, there will be pain, but the doctor will give me symptom control. Chemotherapy, I'll lose my beautiful hair, right? Okay, but doctors assured me that I've seen so many people in the in support group meeting, their hair has come back very nicely. Or I will take this. I'm suffering so much because of breast cancer. I can understand what every female will go through. No, I want to donate my hair for them to have wigs, right? Mastectomy, you feel that your femininity is lost because one of your breasts is removed. So today you got breast reconstruction surgery. You don't have to go for artificial breasts. You can, they do, especially for young breast cancer patients, they do that. So this is one. COPD, chronic obstructive pulmonary disorder, ability to breathe, okay, because of lifestyle. So chronic condition generally in a way is the result of the lifestyle, and alteration in the lifestyle is very, very important. So COPD, hypertension, your cardio, renal, right, nephro, kidney, all these things can have. Okay, dialysis for that matter is a result of palliative care. So all these things can come. And mental health also will be taken into care. Mental health as a sequelae of this chronic condition, because I'm so fond of food. I'm so fond of every Saturday I need to have a bottle of beer, but my kidney is given way. I experience bladder incontinence. Every 5 minutes I have to go to the loo, right? Or I have to have a bag hanging around. I can't go with my friends with bag hanging around, right? So many such things. For you as a common person, chronic condition, no permanent cure, long trajectory except cancer, right? Okay, and alteration lifestyle and medication you have to do. So I know today I'm a guest in Kolkata, so they're going to treat me to nice Bengali sweets. So I already had my tablets. So that's my preventive approach that I'm doing.
Sir, a lot of illnesses not just affect the patients physically, they also affect them emotionally, spiritually, they affect their relationships. So, how do you think palliative care addresses these concerns in patients?
Palliative care is a very comprehensive system to support a human being whose condition can cause a lot of emotional turmoil, psychological pressures, okay, uh, social uh, stigma, okay. So therefore, uh, every chronic condition that is going to result in all this thing, and eventually existential, especially young patients, they feel very terrible. Like I told you, I look at a lot of adolescent patients. So for them, these issues are very important. I can give you an example. There was this 18-year-old boy who had one form of cancer. Result was his part of the lower limb was amputated, but he was otherwise okay, fairly asymptomatic. But he was able to carry on all his work. I still remember it was 2019 December 31. He had come along with, he's from Bhopal. The patient is from Bhopal, but he was staying in Bombay with his uncle. So his cousin brother was a little older, 23 years old. They both came. So I spoke to them generally, you know. This was third or fourth visit. Um, then this was about 2:33, and I finished about by 3:30. I'd finished. Then I was busy with other patients. Suddenly, he came out of the OPD, and I saw these two boys are still sitting. I was surprised, so I asked. I said, "Is there something to be waiting for? Has the doctor given you any medicine? Somebody has gone to buy medicine." He said, "No, no, no, sir. We want to talk to you. One more question." So I said, "Let me just finish this patient. I'll call you back." He said, "No worry. You take your time. We'll wait for you. We'd like to ask you this question when nobody is there." I said, "Fine, no problem." 5:15, I finished the OPD. Then I just opened the door. I said, "Come." So the patient was sitting there. The boy came. His cousin brother came first. He said, "Sir, today is December 31st." I said, "Yes, December 31st." Okay, he's asking whether I can have a drink. I said, "Of course, he can have a drink. But you remember how much you can take care of him, you take care. If that drink is going to cause problem to you to take care, then it's definitely a problem for him. Okay, but to satisfy, give him." Then he came again. "Should he have whiskey? Should he have beer? Should he have? I said, "Whatever he wants to have in moderate, just have one." Okay. Then again he came after 10 minutes, and I could see his face was all red and sweating. He said, he loves to dance. Can he dance? This is my therapist. I said, "Yeah, you hold him, be careful. Let him not to tire himself, and let him be a little more careful. Okay. Not a lot of movements and all that." Then came the final thing. He says he wants to have sex. Can I allow him? Now this can tell you the anguish of an 18-year-old boy who's getting into a relationship. They always tell me, just now I finished my PhD. I mean, in my PhD, this was the question all the 16, 17, 18-year-old children ask me. Can I become a father? I've just got into a relationship with a friend of mine. We are in the second semester of the college. Can I tell her? We both had decided after college, we'll take a call, we'll meet our parents. Okay. They said the doctors only address the current issues. आपके बाल झड़ जाएंगे लेकिन दोबारा आ जाएगा, आपको फलाना होगा, but they don't address this long term thing. We also want to be very normal. And especially there were three only sons in the population. They said, I will be a curse on my family if I'm not able to continue the family lineage. My parents are looking so much to my getting married and giving them a grandson or a granddaughter. My life will have no meaning. Imagine they're okay with the disease, they are controlled symptoms, doctors are very happy with it. Look at what is troubling them. Right? Does it answer that question of yours?
Absolutely, sir.
Yeah.
Sir, a lot of the times patients feel that starting palliative care means giving up on treatment. So, how would you like to address that?
So that is where we don't want palliative care to come separately at a time when the problem has already started building. Okay. Now, for example, when I come as early palliative care, or just when you're diagnosed with a particular disease, right? Okay. Um, for example, uh, there is one problem, neurological condition, Huntington disease. The statistics shows a lot of young parents get that. Now, a 34-year-old mother getting it with a 5-year-old child. That is the time the child will learn what is affection, what is maternal love. But because of her involuntary movement, the child will get very scared to go near mother. Right? So, but she's going to live for a very long time. So the caregiver is going to have a very tough time. Right? Because I have to take care not only of the patient, but the childhood of this child, her son or daughter. Okay. That is why we insist when the doctor feels that this is going to be a chronic condition, it can be oncology, it can be cardiology, nephrology, anything it can be. Their life is going to be compromised, which will spill over to the family members because they are going to be burdened by the caregiving. Now, in this caregiving, physically, right? If the man is atta katta, the wife has to turn him and toss him in the bed. He can't get up. Physical labor is so much. And then she has to manage the domestic responsibilities. She has to send the child to the school. Or even a man, a wife is chronic condition. He has to ensure the breakfast, and the wife already feels guilty. There is a role reversal. I feel very bad when my husband, who's a man, is doing all these things. And I as a woman, was supposed to do this. I'm not able to do this. And money also is important. So he has to go to work. Children also has to be important. Somebody has to guide them, right? That's why we want palliative care to come right at the beginning. So, like how the doctors take they take care of their physical symptom, they take care vitals, of the vitals, that everything is functioning very well. Okay, like that, we take history of you as a human being, right? And we try in our relationship building with you, what are the things that can bring distress to you? We try and work. Okay. Now, just to give a very simple example, how what palliative care did. So there was a 45-year-old man, quite some time before, he was admitted one form of blood cancer. So one day I was just in the ward and with the doctor, and I saw that man was sleeping. By the side of his bed was a tray, and in the tray was his breakfast. So I saw this breakfast, one banana and one bread, something, and it was untouched like that. So I just went near him. I said, "You don't want to eat breakfast?" I said, "You did not like the breakfast? I can always try and get something else for you." He said, "मन नहीं लग रहा है डॉक्टर खाने के लिए." Okay. So I said, "Can I talk to you? Or if you're sleeping, I will come some other time." He said, "No, no, no, no. मुझे अच्छा लगता है आप आके बात करिए." His wife and son had gone down. The son wanted something. He'd gone down. He was alone. So I drew the chair. I sat next to him. I started asking, "What were you?" Cut the story short, he was a maths teacher. He was teaching mathematics for 10th standard students and 12th standard students from interior Maharashtra. So I casually asked him, "Would you like to take tuition?" So he laughed. He said, "Saab, मजाक कर रहे हैं आप. मैं कैसे पढ़ा सकता हूँ?" I said, "No, I don't want you to have a timetable. Monday 10 to 12, 12 standard, whenever you want, whenever you feel you're okay to it. It can be one sum." So the volunteers of our department, they went around and spoke to the shanties around the hospital because they can't afford private tuitions. So next day, two boys came. There came a time when he had in the morning 10 to 11, 19 children of 10th standard, evening 4 to 5, 22 children of this thing. So when I went to him, he hugged me. He said, "आपने मुझे नया जीवन दे दिया है." Then he said, "My only worry is, I know I'm not going to live there for a very long time, and but I'm worried about my wife." So I told him, some social workers, "Can you just talk to the wife? What she knows, we can try and rehabilitate her." So they found that she knows tailoring. We ran to Indian Cancer Society, which is very close to a hospital. They said, "Please send her here," because Indian Cancer Society employs such caregiving patients, and they come up with a lot of their, now Diwali, Dashra, they come with a lot of items, jute bags, kurta, so many things they bring. So we can tell her. He saw his wife dignifiedly employed with 7,000 rupees salary per month. Then he said, "साहब आप तो भगवान हैं हमारे लिए, आपने इतना मदद किया, अब एक छोटी सी रिक्वेस्ट है." His son was in 7th standard. Is there any way? So again, this social workers volunteers, when they got hold of a donor, that donor told him, "I am responsible for his education till graduation. I will take care of his son. And if he does really well, I will also fund his, post graduation." That boy is now working as a software engineer in one of the organizations. Now, we could not do anything to the disease. Palliative care could not do anything to the disease, but we impacted the journey. He died without any anguish, without any distress. Happily, that his wife is settled, the family will not suffer.
That was a very inspiring
Yeah,
story, sir.
it's a real life story. This is what we at Palliative Care has done. This is one of the stories. There are so many other palliative care people and so many this thing. They have done more fantastic job.
So, what you just explained to us, I feel that palliative care doesn't mean that it's the end of a person's life. I think it means that it's the beginning of another journey for the patients.
Probably you said it very nicely, uh, but some of the patients know that their life is going to end, right?
Mhm.
Uh, so that is why now we have started talking about advanced directives. That means, what would you prefer? We want to involve the patient in his caregiving in a very simple one line, that we don't want unnecessary jumping from one doctor to another doctor, one clinic, nursing home to another nursing home, and trying all kinds of invasive treatment when nothing is going to happen. We want to save that person of the trouble, the family of experiencing that helplessness educated, not educated, lot of money, no money, ultimately everything goes through. So when we talk about palliative care, we are talking about the opportunity that is being given, not just to the patient, definitely patient, for an uncompromised quality of life, dignity. We value you, you matter to us because you're still a human being, and we have to look at you regardless of the disease, right? You have desires for future, you can discuss with that, that is there. So therefore palliative care is coming close to you, reinforcing that you're a lovely human being, loved human being, and you deserve this holistic treatment which looks after your physical symptom, your psychosocial problems, right, and some practical concerns. That is why it is a multidisciplinary team. One doctor alone cannot do everything, right? So I look after your mental state. A social worker will assess the social situation of the family, rehabilitation, like the example that I gave of the lady to get into a tailoring course, the son, somebody adopting. I've rehabilitated the family. The family will continue to lead a life of dignity. That is why we don't talk about help. Because as one single person, how can I keep on helping? I have so many patients, but I will empower you. You know tailoring, I'll provide you opportunity. So you don't have to feel bad ki I'm also living on somebody else's mercy. These are very important to the person. So we respect the core of human dignity. That's what we do. So palliative care is definitely is not abandoning you, not giving up hope, and not necessarily the end. We are not looking at the end. We are looking at the journey. Where are the hurdles and how can we clear the path for you as much as possible?
Right.
That's
Absolutely, absolutely. So, since we're already talking about families, so how do you think cultural and religious beliefs of the families of the patients, how do they view palliative care?
you all have to play a very major role. Media has to play a very major role. Um, so culturally, India, death is a social phenomena, not as a medical phenomena. Okay. For example, in my OPD, a 87-year-old father, he says, मैं तो sir मरने के लिए तैयार हूँ, बच्चे समझते नहीं हैं. But the 70-year-old son will show me from back, don't tell him, don't tell him. So for a pediatric child's father or mother, it's a failure to protect, because as a parent, we have taken the role of protecting our child. That child has been diagnosed with a particular cancer and going to die. Parents, it's the thing that can give distress is absolutely terrible. So that is one. Adolescent family thing. I mean, the boy loses all the opportunity. The family loses the opportunity of the boy or the girl, adolescent, with all the aspirations and everything. They die, right? So that's again a problem. So what we are trying to tell you is caregivers go through as much as the patient. Okay, there are very many studies that talks about caregivers feeling guilty, caregivers having spiritual distress, caregivers having you know anxiety, so many things. So let me take you through a very lovely real life situation in happened to a family from Odisha, Bhubaneswar. So on a one evening at 5 o'clock, the father, the mother, and the daughter, 8-year-old, they walk into our department. Husband all misty-eyed, mother howling away to glory, and this child not knowing anything. So the child is taken by another psychologist to play in a separate room. Doctor is sitting here, the father is sitting here. I am sitting next to the doctor, the mother is sitting here. So the doctor keeps on explaining what is palliative, why the file has been transferred here, what happened in the main treating unit, and now what to expect, what is the good. The father understands intellectually, but emotionally he's not, he still cries. The mother sitting over there, non-stop 45 minutes howling, and I had brought them a cup of tea. So mother's chai यहाँ पे है, father's chai वहाँ पे, and हम लोग की chai यहाँ पे, just sitting. In that 45 minutes, she uttered something to herself. I'll tell you what she was uttering to herself. She was uttering, भगवान मेरे साथ ऐसे कैसे कर सकता है, भगवान मेरे साथ ऐसे कैसे कर सकता है. In that 45 minutes, every fifth minute was this one statement, again resume crying. What do you think I, as a psychologist or a, you know, somebody who's addressing psychosocial will do? Because bone marrow transplant is also failed. The disease is spread out of bone marrow also, so no chance. So I asked her. I did not talk anything about the disease. When she uttered the word so many times, I only said, "Madam, लगता है आप भगवान से बहुत नाराज हैं." She just lunged the table like this. The tea fell on me. The tea fell on. I said, "Don't worry." She said, "और नहीं तो क्या? My father-in-law is a pandit. His three brothers are pandit. My husband is a pandit. His three cousin brothers are pandit. हमारे घर में शिव और पार्वती, राम और सीता की पूजा रोज़ होती है। हमारे फादर इन लॉ जो रोज़ सुबह 4:30 बजे पूजा करते हैं, वो घंटी की आवाज़ से हम लोग सो उठते हैं। ऐसे घर में कैंसर कैसे आ सकता है? और कैंसर आया, बच्चे को इतना तकलीफ देता है, अभी कैंसर ठीक भी नहीं होगा। This is the spiritual distress. I worked with her family for 3 years. She was, people were telling that every day, every month, she'll buy her favorite item and she'll go and keep it in the photo. For Durga Puja, she'll buy some dress for her and keep it this thing. So we got worried whether is it hallucination, is it some mental health issues and all. Walked. Finally, she said, I used to talk to my daughter every day. Okay. So I used to tell her, what does your daughter tell you? What is the meaning of the... So finally, we came to a conclusion that her daughter has left behind another 25 Swati, girl named Swati. And those 25 Swatis can be seen in the school. So we spoke to the school authorities, and this lady used to visit the school to meet her 25 Swatis and make something every 3 or 4 months. आज स्वाति की तरफ से आपको है. But now she's okay. She's a proper wife. She said, I'll throw all the murtis out of this thing. I'm going to go and reply to my father-in-law. All these things she asked, but now she's come back to normal life. So this is what we as a palliative care did.
That was again a very, very beautiful story, sir. There are times when many families are not very sure of palliative care. Sir, what would be your one piece of advice that you would like to give to our viewers for such families who are not sure?
Okay.
Yeah.
So having worked in this field for 15 years, even today, I find communicating with them challenging. Because the moment the doctor says, हमने बहुत कोशिश करी है, but I don't think the diseases, they will go for second opinion, third opinions. I've had situation where I know the child is not even going to cross this footpath and go to the next building. They will say, we heard in Pune when Babaji is there, you will make you wear one kala, this thing, you wear that and you'll become all right. Now, this is all coming from the hope. For a parent, their only child losing is very difficult. For a young lady, losing a husband is difficult. So, there is a lot of such things surrounding the death. So, what we are going to tell them is, you will be not palliative. No. Okay. So, let me just give you one quick example. There was this 22-year-old boy who knows everything. He's not going to survive because the doctor sent him. But the doctor has constantly used the word tumor. The moment I use the word cancer, he got such a jolt. He said, मुझे cancer हुआ है? I said, yeah, you were telling all these things, no? Doctor ने बोला मुझे tumor हुआ है. So he did not understand the difference. So I had to tell him simple potato. Right? In the UP and Bihar, they call it aloo. In western part of Maharashtra, Gujarat, etc., they call batata. They are same. Right? But see how the name was traumatizing. So answering your question, one piece of advice, when I go as a non-medical, as a psychologist or a social worker, I'm only going to talk to you. Okay, now the doctor has advised you. Okay, what do you think are your concern? Right? So they'll say, oh my God, doctors told me that there'll be chemotherapy, then they'll come. Yeah. What about chemotherapy is worrying you? Okay. So assuring them, that is the reason why we have to be there right in the beginning. Now, what happened? Because in many places, the family had a lot of hope because the treatment was on and treatment reduced the symptom. But the disease is progressing. So the doctor said, now chemotherapy will not work. Now you go to palliative care. They have no idea. So you as a doctor built a hope. The family had a lot of trust. And I am supposed to be breaking the hope and still build the trust.
Right.
So it's a big challenge for us. Right? Okay. So first, one word answer is, don't introduce them as palliative care, anything like that. Just say that the doctor has to say, treating doctor, we are a part of the multidisciplinary team, and I've seen your reports, I've seen your disease, so I'll make you go through this treatment. The treatment will have, little aggression depending on the age. Aggressive it will be, but I always have my team to help you. So ask him.
Mhm.
So this question will be typically, मैंने सुना है chemotherapy से बाल जड़ जाते हैं. So the question that come, all these things are about pain, about body image, and so many other issues. Will I be able to do that? Will I be able to do this? Okay. So that I, as a psychologist, I understand how these things are very important for you. Right? So you don't have to say, okay, now the doctor has sent you, let me introduce you to palliative care. I take all these things. So, in my opinion, the moment they come, first thing I address, the protocol is I have to talk to the caregivers first. Then only with their permission I have to talk to the patient. So I'll
Mhm.
first address the emotion of the caregiver. Two simple things. Did you have breakfast? Right? Did you sleep well? Right? Yeah.
Right.
So that they come in, catch hold of my fist and they start crying. I said, no problem. Cry. I ask them, what is disturbing you so much? का रात भर सर वो दर्द के मारे सो नहीं पाया. अच्छा, दर्द आपका शिकायत है. Okay, so you have to speak what you can do. So I will inform the doctor, and doctor will give you, or nurse will give you pain medication. I'm sure you'll feel better. So that is why we follow the principle of ask, tell, ask. You don't start telling them, oh madam, this is department of palliative medicine, only people whose treatment fails, only they come. No. Right? So I say, okay, so this introduction, the way you approach the caregivers will break open. Simple. आपने कुछ खाया? So it is very challenging. I have to have the verbal skill correctly to talk to you. At the same time, I have to look at your face for cues of emotions. You'll have a hoarse voice, right? There'll be kharash. Then you don't want to look at me. You'll want to scratch your head and keep looking at me, or you'll turn your gaze. All these things are cues for me. How you're trying to control the emotion that is flooding. Unfortunately, you could be one of the caregivers. You dropped out of the exam because you had to accompany your family person for 3 chemotherapies, right? And it becomes a little difficult. You're a young girl. If a man kind of touches you, there are a lot of gender this thing. So we explain all these things to them. So one word, find out the emotion, what you can do to control and make them feel normal.
That's a great
Treatment अपनी जगह.
approach.
That is the main thing. So that's why asking them, what is your वैसे बहुत सारे हैं sir. Tell me now which one you want to address first. We'll talk about that. When they are getting up and going, then I tell them. Doctor must have told you. But doctor will not also tell completely, because once they say treatment nahi hone wala hai, rest they are blocked completely. So I always tell them, other counselors, don't get angry. कितनी बार समझाओ, बार-बार वही सवाल करता है. He needs more help. Doctor has told, oh, this PET scan showed me this report, the disease has gone from this place to that place. They have not understood. When the doctor said there is no cure, they have seen their house crumbling. They are saying, oh my God, I thought I'll educate my son something. I thought I'll get my daughter married in a fantastic way. They are listening to all those things. So what you listen as a family caregiver or as a patient is different from what you're talking, right? So we handle this. So we are expert in a session called as breaking the bad news. As a society, I don't think anybody's got a degree in breaking the bad news. We have always given only good news. And we have been rewarded for giving that good news. We've never given a bad news. But this news is bad because once they hear treatment is not possible, the perception is my future is shattered. The future is affected very adversely, very seriously.
That is
That's one piece of
that
advice.
is an
That
absolute
have
great approach. Yeah.
multidisciplinary team
Mm.
and address the
Mm.
caregiver's emotion first and tell them, find out what is their immediate concern,
Mhm.
attend to that. Some kind of normalcy and control is what all of us like. For example, we used to earlier, as a mental health professional, a psychologist, we used to say adjustment disorder. But we no longer use, the moment we say disorder, we call it distress. That is why National Comprehensive Cancer Network has termed distress as the sixth vital sign. The doctors only see your pulse, your oxygen saturation, your heartbeat, everything. Now they have to see the distress. And to screen that distress is psychologists, social workers, psycho-oncologists, all these people are there. Right?
Right.
And beyond a point, when they come to the hospice after all that, then you don't use any scale and find out what it is.
Mhm.
You should know how to help him handle his loneliness.
Right. Great, sir. Sir, as per the data that we got to know over the last few years, I don't think there's a lot of training available on palliative care. It's probably very limited. So, what is your take on this for India, of course? What would
I've
you
just come
say
back
on
from
that?
yesterday from Tirupati doing a
Mhm,
training program.
mhm,
So we have a body called as Indian Association for Palliative Care,
mhm,
IAPC.
mhm,
I think, to my mind, there are about 5,000 members there in that.
mhm.
Dr. Shrikant is also a member
Yeah.
of it.
Mhm,
So one of the mandate for them is to educate doctors, nurses, and community volunteers.
okay.
Doctor alone cannot do. Community
Mhm,
volunteers are there. Now, for example, Dr. Gaurav is doing a wonderful job of
mhm,
empowering in the interiors of Kolkata, in the rural parts of
mhm,
Kolkata, training community workers and telling him. And so doctor, nurses, and the community workers together handle the patient. And you remember in the rural India, maybe because of their poor literacy, socioeconomic condition, a lot of superstitions are there. They don't trust you so easily. So we find one champion of that area, he talks to them their language. That's what you know. So it is not so bad as you imagine.
mhm,
Things have improved quite a lot, and we are doing in a year. I do 10 training programs. So one end of corner northeast, the Dibrugarh to Tirupati in south in one corner we do. So I'm responsible for training community of the thing, and sometimes doctors and nurses also join in the training program.
okay. Sir, it was great to talk to you on palliative care. We got to know a lot about palliative care actually, and I think a lot of the confusion that our viewers have about whether or not to opt for palliative care, that should be cleared hearing today's podcast.
Yeah.
So thank you so much for being on our podcast
Thank you
today.
very much.
Yeah.
One last important thing
Mhm,
we did not touch on is
mhm,
that one of the source of distress to the family is drained financially. Every second patient comes to me, सारा घर बाहर भेज दिया साहब, अभी आप बोल रहे हो कि कुछ नहीं हो सकता है. We don't want, like, medicine treatment generates toxicity in your body, but this begging, borrowing money, doing away with the family, a little bit of corpus, everything is ruined. So we have financial toxicity. We have cases where people from very wealthy family have come to the rules. So palliative care addresses that also. Please understand that there is only so much we can do, but that not compromise your life. Would you like your person to be managing his or her own activity daily life? Will it not give you happiness? I know it is very difficult, but will that give you happiness? कम से कम आपने इतना तो किया उसके लिए. Yeah, right. So don't unnecessarily go for futile medical expenses, and keep that money for something more productive. And the person will appreciate. मैं नहीं हूँ, but still my child got educated. My daughter got married. That's the advice.
great. Thank you for that advice. Thank you for your time, and thank you for all the inspiring examples that you shared with our viewers. It was a really, really insightful session and very informative, of
Thank
course.
you.
Thank you to our viewers for watching. If you want us to address any specific health condition in our podcast, please do write to us at podcast@sastasundar.com. You can also comment in our comment box. Do not forget to like, share, and subscribe to our YouTube channel for more such health related content. Download the SastaSundar app for 100% genuine medicine, 18% discount, and free home delivery. Thank you for watching. We will see you in our next one.